Hello, and welcome to Living with Spina Bifida. Today we're going to do a little bit of education and learning. What is Spina Bifida? Some of you may have heard of the word and just have never experienced it, have never met anyone with it, just know absolutely nothing about it. And if you are living with it, then you may not know every little detail about it. Maybe you know a little bit about your own spina bifida, but every case is different. It is called the Snowflake birth defect for a reason, because every single case is different. Every single person is affected differently. Even if you have the same kind of spina bifida, one person with the same type of spina bifida and the same level might walk where another person is paralyzed completely and they can't use any of their extremities. So every case is different, every person is different, and this channel is through my experience with spina bifida. I am one person and I would love to get more knowledge out there. There are a lot of doctors that don't even know what spina bifida is, but spina bifida is the most permanently disabling birth defect in the United States. It is the #1 birth defect, and people still don't know anything about it because a lot of times they don't consider it important enough to do research, or charities raise money for it because all it does is make you a little different, and they don't think it's that important to get it out there. And there's more things, since more illnesses and whatnot are killing people, they don't think that we need to know about the other ones that aren't exactly killing everyone that has it. So this is my little corner of the internet trying to get education out there about spina bifida, because it's kind of a big deal to me. It's kind of what I do. I kind of have spina bifida all day, every day. Never going away. Never, ever, ever. So, what is spina bifida? It literally means split spine. When the baby is born, they, depending on the severity of the spina bifida, they either, the column of the spine, it doesn't close all of the way, and sometimes they're born with their nerves and whatnot coming out of the spine, and other times there's a sac on top of it, on top of the spine, in the area of the injury. And that's what it is. They get it fixed, repaired as soon as possible. And then depending on the level, each person is affected differently depending on where their injury was. And like I said, it's not always going to pertain to everyone. The same disabling effects, the same issues and whatnot are not always going to be the same for each person, because each person, their body handles it differently. So the first spina bifida we have, you have to bear with me because I'm reading this, because I'm just not that great at memorizing things. So you're going to read along and find this out. We have occult spinal dysraphism, OSD. Infants with this have a dimple in their lower back. Because most babies with dimples do not have OSD, a doctor has to check using special tools and tests to be sure. Other signs are red marks, hyperpigmented patches on the back, tufts of hair or small lumps. In OSD, the spinal cord may not grow the right way and can cause serious problems as a child grows up. So while they're growing, their spine may not grow correctly. Infants who might have OSD should be seen by a doctor who will recommend tests. And they don't really have any issues with that kind of spina bifida. And next we have Spina Bifida occulta, which is often called hidden spina bifida, because 15% of healthy people have it and do not know it, like ever. There's only really one way to find out, and that's if you went to the doctor and you had an injury for another reason and you had tests done and they said, oh look, you have spina bifida as well. Surprise! Spina bifida occulta usually does not cause harm and has no visible signs, like I said. The spinal cord and nerves are usually fine. People find out that they have it after having an x-ray on their back. It is considered an incidental finding because the x-ray is normally done for other reasons. However, in a small group of people with SBO, pain and neurological symptoms may occur. Tethered cord can be an insidious complication that requires investigation by a neurosurgeon. Next, we have meningocele. A meningocele causes part of the spinal cord to come through the spine like a sac that is pushed out. Nerve fluid is in the sac and there is usually no nerve damage. Individuals with this condition may have minor disabilities. Myelomeningocele is also called Spina Bifida cystica. This is the most severe form of spina bifida. It happens when parts of the spinal cord and nerves come through the open part of the spine. It causes nerve damage and other disabilities. 70 to 90% of children with this condition also have too much fluid on their brains. This happens because fluid that protects the brain and spinal cord is unable to drain like it should. The fluid builds up, causing pressure and swelling. Without treatment, a person's head grows too big and may have brain damage. Children who do not have spina bifida can also have this problem, so parents need to check with a doctor. This is called hydrocephalus, and that will be covered in another video. What causes spina bifida? Guesses. That's really all they have right now. Some people say it has to do with the diet. Some people say it has to do with the environment. Some people think it's genetic. Or maybe it's all of those things. But a good way to prevent it is to have the right amount of folic acid while you are pregnant. And I will cover folic acid in another video as well. And how is spina bifida treated? A child with meningocele usually is operated on within 2 to 3 days of birth. So itty bitty babies have surgeries. This prevents infections and helps save the spinal cord from more damage. A child with meningocele usually has it treated with surgery, and more often than not, the child is not paralyzed. Most children with this condition grow up fine, but they should be checked by a doctor because they could have other serious problems too. A child with OSD should see a surgeon. Most experts think that surgery is needed early to keep nerves in the brain from becoming more damaged as the child grows. In Spina Bifida occulta, they don't usually need to treat that. Just leave it alone. And can Spina Bifida be detected before birth? Yes. There's 3 tests to determine if Spina Bifida is going to happen. A blood test during the 16th to 18th week of pregnancy can happen. This test is higher in about 75 to 80% of women who have a fetus with Spina Bifida. An ultrasound of the fetus, this is also called a sonogram, and can show signs of Spina Bifida such as the open spine. A test where a small amount of the fluid from the womb is taken through a needle. This is called maternal amniocentesis and can be used to look at protein levels. That doesn't sound very thrilling. But some people find it very important to know ahead of time what's going on with the babies. Can children with Spina Bifida grow up and live full lives? Well, you are looking at an example of a child who was born with spina bifida, and I am now living a full life. I am 29 years old. I've been married for 8 years. I have a 6-year-old, and I have a job. So I could say that I'm living quite a full life despite having spina bifida. So the answers on the internet say, yes, with help, children with spina bifida can lead full lives. Most do well in school, and many play in sports. Because of today's medicine, about 90% of babies born with spina bifida now live to be adults. Yay, adults! About 80% have normal intelligence, and about 75% play sports and do other fun activities. Yay, fun activities. How is spina bifida managed? As type and level of severity differ among people with spina bifida, each person with the condition faces different challenges and may require different treatments. The best way to manage spina bifida is with a team approach. Go team! Members of the team may include neurosurgeons, urologists, orthopedists, physical and occupational therapists, orthotists, physiologists, and medical social workers. So, in the end, how is this affecting me? I've had about 10 surgeries related to spina bifida in my lifetime. I've had my feet fixed. I was born with a club foot, and now it's a pretty normal foot, I guess. I don't have any movement or dexterity in my left foot. I can move my left knee and my left hip leg area, but I have limited feeling to no feeling in certain areas. It's sporadic feeling from my hip to my toes. I can't move my toes. I can't move my feet. My right side, though, is perfectly normal. Normal. And it functions like any other person's body would. I have bladder issues. I do not catheterize because I found out 10 years ago stopping catheterizing has caused me to have 0 UTIs, urinary tract infections. So, catheterizing is you stick a tube up the urinary tract, and then it helps you empty your bladder. And me, I decided to not do that, and I'm doing pretty okay. I just pee a lot more during the day than most normal people would. So, I haven't had any problems. My kidneys are functioning. My bladder is working perfectly fine. And pooping, get a lot of constipation. Get a lot of not going to the bathroom. So, you just have to try your best to have a high fiber diet, drink a lot of water, and sometimes you might have to take medicines or suppositories or anything like that to help things get going. I have hydrocephalus, and I will talk about that in another video, what it is exactly, but I don't know if it's because of that, if it's because of history, family history, or what, but I have a lot of migraines. I have a lot of foggy days. I have a lot of just, my head is just not right. I'm tired a lot, exhausted all of the time, and I usually just power through it. Some days I'm lucky enough to have my husband home where he can let me take a rest, take a nap, and it doesn't always really help, but it gives me some relief for a little bit. I don't really have a lot of back pain, which is surprising to some people, but because of the curve in my spine, I have scoliosis, And because of that, my shoulders are uneven, so I have a lot of neck and shoulder pain with my curve. But if I'm doing a lot of strenuous activities and whatnot, I do get, back pain and whatnot, and that's just to be expected for anyone. Walking is pretty difficult, especially the last year or so. My knees are starting to give up on me. Sometimes, without any pain, my knee just stops working. Doesn't hurt, it just doesn't work. And I do have a lot of consistent pain in my knees, just because that's what it wants to do. I have a lot of hip pain, especially going up and down stairs, walking long distances. Standing in one place isn't my forte, and that's when I start to get lower back pain. So a lot of the times I use a wheelchair. I don't use one in my home because I have 2 levels, stairs, and honestly, this place is just too darn small for a wheelchair. It's not wheelchair accessible at all. But it's a place to live, so we do what we can do. I use a wheelchair when I'm going just about anywhere nowadays. At first I thought it was because I was just lazy, but now it's starting to look like I need that wheelchair almost all the time because of pain from walking and using too much of my body too much of the time. Walking around, standing around, just doesn't like it very much. So for the most part, I live a pretty normal life, except I do things a little differently, and I'll go through different demonstrations of doing different things in other videos. This is just kind of an introduction to my life with Spina Bifida and what it is. And like I said, my videos are pretty sporadic. My videos are pretty out there. I don't really plan too far ahead with my videos, so if you have any more questions about what Spina Bifida is, I will gladly answer them either in the comments or I will make another video completely with your questions. So send me emails, send me comments, and we will just keep getting this knowledge out there as best as I can. So until next time, we'll see ya.